In your health news, nearly 1 in 3 people in the U.S. will develop shingles, a painful rash that develops on one side of the body or face at some point in their lifetime. So what really causes shingles and who is at the greatest risk? Dr. Mitchel Goldman is here, as he is every Tuesday, with some answers for us tonight from UCSD. Thanks for being here.
It's great to be here.
Well, I have some personal experience with this. My mother came down with shingles at one point, and it was really hard to watch her go through it. It's very painful. What causes the pain when outwardly it just looks like a rash?
Well, shingles will occur in almost 1 million people a year in the United States, and almost half of everyone, if they reach the 85, is going to get shingles, and my mom got it as well. So what happens is shingles is a reactivation of something called chickenpox virus that most of us have gotten when we were younger. And for some reason, when we're more immunodepressed, when we're under more stress, it's going to come back. And so if it comes back, and again, it's going to come back in almost half of all of us, it goes down the nerve root fiber. And as this virus is traveling down the nerve root, what it does is it inflames that nerve root and causes something called post-herpetic neuralgia. Now, these are pictures of what it looks like, and usually it's a band across the chest or somewhere, and you see these little blisters, and then the blisters, when you have blisters, you're actually infectious. You can actually pass on chickenpox to someone that has never had it before. And then the rash sort of goes away and crusts up, and then you're not infectious anymore. But again, as it goes down the nerve, it's going to inflame the nerve, and that's what causes a condition called post-herpetic neuralgia, which can occur in almost 50% of people.
Well, it's interesting because you brought up how it's related to the chickenpox. So then is there a vaccine that can prevent it as well, or does the chickenpox vaccine do some good in terms of preventing shingles?
No, the chickenpox vaccine doesn't do anything good to prevent this shingles from occurring. But any person over the age of 50 should be vaccinated against shingles. And so you have a Varicella vaccine. And I had it done, and most people should get it done, and the FDA wants you to get it done, especially after the age of 60, because the older we get, the more likely we are to get the shingles. And the biggest problem, again, is you don't want to get shingles, because then you've got almost a 50% chance of having pain. And as you know from your mom and my mom, the pain can last for upwards of a year or more, and there's almost nothing you can do about the pain. There's a company here in San Diego that's doing an experimental treatment to try to correct the pain, and there's a number of other experimental treatments going on. But right now, today, it's very difficult to alleviate the pain.
So Dr. G, what are the early symptoms, and is there any way that early intervention can stave it off in any way?
Great question, Kathleen, and the answer is yes. Usually what will happen is you'll get this tingling sensation across your chest or somewhere on your face, and then you might get and see a blister or two. At that point, if you see your doctor and you get treated with a medication called Famvir or Valacyclovir, Valtrex, you'll stop the zoster in its tracks, and you will never get the blister. And studies have shown that if you can stop it very quickly, you'll prevent that post-herpetic neuralgia. But you know, the best way is not to get it in the first place. And that's why we advise getting vaccinated. Now, the one question we have is, how long does the vaccination last? And nobody really knows. What we think now is it'll last for about 6 years or more. So usually if you've been vaccinated, you should talk with your doctor and see after about 5 years whether you need to get a booster. We don't know exactly when the right time is to get a booster. That's something that you should talk with your doctor about.
And you mentioned that odds are very high that if you do get it, you'll get it again.
Well, no, not necessarily. If you get the shingles once, usually you don't get it again, but you can get it again. So just getting shingles once doesn't protect you for the rest of your life, especially if we're going to grow up to be 90 years old or 95 or more. You should still consider getting the vaccine, but that's a conversation you need to have with your physician.
All right, Dr. G, thank you so much for that information. It's definitely something you don't want to get, so hopefully people will heed your advice and nip it in the bud, so to speak.
Thanks, Kathleen.